Hello and welcome to The Agenda. I'm Stephen Cole. COVID-19 has had an impact on much of the world's population, but those affected haven't only suffered physically. Many have also suffered less visible trauma, increased social isolation, health anxiety, stress, and an economic downturn are all a perfect storm to damage people's mental health and well-being. Helping the helpers, we'll be speaking to the charity supporting Italy's frontline doctors. Plus, can behavioural science slow the spread of COVID-19? And the benefits of boredom, how being in lockdown can actually unlock your imagination. For many people, the global pandemic COVID-19 has stirred feelings of fear, anxiety, and stress. But a degree of stress in our lives can be a good thing. It can force us to think about how to be safer. It can motivate us to keep our distance, wash our hands, and follow government guidelines. But prolonged periods of stress can also have a negative impact on our mental and physical well-being. Healthcare professionals around the world have been offering guidance to show how to stay mentally strong, emphasizing the importance of exercise, routine, and avoiding consuming too much bad news, alcohol, and endless scrolling through social media. It seems with little to look forward to and nothing to plan for, people are turning to their screens more than ever. Some estimates suggest time spent on Facebook, Twitter, and Instagram is up by as much as 82% since lockdown began. But mental health experts say increased social media use has been proven to contribute to feelings of depression, anxiety, and trauma. By nature, human beings are social animals, so isolation has proved to be a big problem for many of us. And of course, once it's all over, we'll be faced with a new level of anxiety about going back into the world we used to know. When faced with trauma, there is a peak and a valley response. Right now, we're at a peak where we engage with the immediate threat of the pandemic. Our bodies go into survival mode, which can be very taxing on mental health. The nervous system can't process everything we are experiencing and focuses instead on keeping us alive. Humans have an incredible ability to survive prolonged periods of stress, and once a pandemic and lockdowns are over, there will be a steep valley where we recover. But that doesn't mean the risk is over, because many people will suffer trauma and depression. So, the big question is, how do we get back to that healthy baseline? And exactly what kind of support will people need to get there? Dr Damiano Rizzi is the founder and president of Soleterre, an Italian organization dedicated to supporting doctors and nurses on some of the front lines of the worst hit hospitals in that country. And he joins me now from Pavia, outside Milan. Dr Rizzi, do doctors and nurses, you think, need psychological support through this COVID-19 pandemic?
Sure, they need, because it was an extraordinary experience. They worked for a lot of hours in a day with a body without personality. I mean that people arrive in emergency department without the possibility to have hair, and they can't speak about their life. They can speak, and they can speak nothing about their stories, their life. And for doctors, it's impossible to treat person without know the history. And they say us, we have the sensation to treat body without personality, without soul, and it was a dishuman experience.
So what kind of psychological support, what kind of counseling do they need?
So we made an extraordinary experience in first line and we give directly psychological support, and we create a new criteria to treat anger, to treat depression, to treat post-traumatic stress disorder. You know, this is there are a lot of symptoms that move in this traumatization experience.
Some of those frontline staff are thinking at the moment that when the worst of the pandemic is over, they will be forgotten. Does that mean they will need counselling for some time to come?
Yeah. There is a particularly defense mechanism that is called dissociation. To have the possibility to work, you haven't to think. So I mean that during the experience, during the work, there is an hyperactivation, and the doctor and nurses work without thinking. Now we are in a moment in which they think again, and for that dissociation is a normal the defense mechanism to don't think, because it was very hard the work.
And is the government supporting your work? Is the government taking it seriously?
Unfortunately, we have to find money by ourselves, because it's very strange. I think that mental disorder or a mental investigation is again similar to stigmatization. And I think that also in this very difficult situation, we haven't found by government.
Lombardy was the worst affected region in Italy. Is there likely to be a long-term effect, not just in Lombardy, but as Italy as a country?
I think with the creation of a national psychological support fund to help not only healthcare, nurses, and doctors, but also the normal population that now is moved from home to work, and a lot of them have a lot of economically problem.
Do you think this in fact can serve a good purpose, so that in future governments and hospital administrators will take the mental pressure that frontline staff are under more seriously?
I hope to, but it's normally before a pandemic situation in an Italian hospital, it's not so normal to have a psychological support paid by the government or by the national sanitary system. A lot of psychological colleagues are paid by private donation. And for that, I'm not so sure that also in this moment after or during the second phase of pandemic situation, COVID-19, I'm not so sure that national hospital can pay for psychological support.
Dr. Damiano Rizzi, many thanks to you for joining us, Doctor.
Thank you very much.
Since the pandemic began, governments around the world have implemented measures that have forced people to dramatically change their daily habits and routines. But how easy is that to do? Behavioural scientists have been key in advising policymakers how to change the way that choices are presented to people in order to make them as effective as possible. Professor Robin Dunbar is the head of the Social and Evolutionary Neuroscience Unit at the University of Oxford, and he joins me now. Professor, how can behavioural science perhaps slow the spread of COVID-19?
Well, actually, I think it's probably doing it in two ways. I mean, most of the government advisors who are behavioural scientists really work on how people kind of believe and accept messages or instructions that are conveyed to them by the government, as it were. How willing are they going to be to adhere to what the government is recommending? I think at the other end of the scale, which possibly has not really been taken into account at all is really the question of just what our social world actually looks like and who it is that we're interested in engaging with on the one hand, and how deeply, emotionally deep those relationships with these people are, which is really where I come from.
So are we seeing what you would describe perhaps as a societal or sociological change, a shift as a result of this pandemic?
I think we're seeing a shift, but it's a shift driven out of fear, basically. It's not, by no means is it the case that people are really voluntarily doing what the government has been instructing them to do. I mean, they might do that in China, maybe, but in general, in the West, we're a little bit too independent-minded. But I think what has been driving people's willingness to adhere above all else has probably been the fear that there is a genuine risk of catching something that might kill you.
What kind of behavior have you been witnessing as a result of lockdown that you didn't see before COVID-19?
Well, you have to see this in the context of the fact that our social worlds are really extremely small scale. We actually individually sit in the sort of center of a series of expanding circles of friendship and family relationships, which include only about 150 people on average, somewhere between probably 100 and 200 are the sort of inner and outer limits on that. You know, those people often tend to be scattered over quite wide areas, obviously particularly true of, I mean, half of that social network of 150 people is actually family, extended family members. And most of those will be kind of distributed around the country, if not around the continent. You know, you make a lot of effort to go and see them from time to time. And particularly that's important with friends, because if you don't see friends, the relationship dies, or decays might be a better word, rather quickly, within a couple of months of dropping the frequency with which you see someone. Most of our friendship circle, as it were, is distributed around a wide geographical area. So what's then been interested is two things, I think. One is the fact that people have suddenly started to get together with other people in their street or even their village, forming little collectives who will go around and help the elderly out, make sure they're getting food and their medicines and all this kind of thing, and making sort of communal arrangements to keep life going. And the other thing is, of course, if I'll use the Italian example, is all standing out on our balconies and singing Verdi arias of an evening, which is another extremely important way of kind of bonding the communities. And it's creating these little sort of sense of your street being a real community. And I think both of these are sort of quite novel. How long they will last after lockdown is lifted,
well,
however, is another matter.
Exactly, that's the $64,000 question.
Now, what I think will probably happen is that people will make a judgment about which relationships are now more important to them once we come out of lockdown. So what will almost certainly happen is that initially there will be a little sort of upsurge of people getting together with their friends and family that they haven't seen for a while.
What part does social media play in all of this? Is it a good part of recovery, of surviving the COVID-19 or not?
It's not a good substitute, ultimately, for face-to-face interactions. I mean, we've done, and others have done research, looking at how good different media are for the quality of your friendships, as it were, how satisfied you feel with the interaction you've had with one of your friends. And there is absolutely no substitute for being able to stare literally into their eyes and grab them by their shoulders. There's something about that sort of physical presence that seems to be really important. Now, video channel media do better than text-based or even telephone media, because they give you that slight sense of being in the same room together. But the interactions my sense is, still have a bit of a sort of edge to it. They're a little bit uncomfortable on things like Skype and Zoom compared to what they would be if you were physically there in the same room. So there is no substitute for physical contact. Yeah.
Can behavioural science teach us anything at all about how to survive lockdown and come out the other side a better person?
It is unquestionably stressful for people simply because we live in a social world. I mean, there are people who are going to find it a lot less stressful, and I think a lot of those are just writers. They're professional journalists and novelists and scientists, dare I say, who spend a lot of their time locked away in a room on their own. The people who will struggle most are undoubtedly the very social people whose natural social environment is down the pub and down the tennis club or whatever it may be, and just like being with people. And I think the answer to that, as with the answer with all these kind of stressful events in life, is just cool it and relax. It's kind of mindfulness, a little yoga in the morning, or dare I say it, a little Pilates by Zoom. The sort of physical exercise and the sense of doing something like that with somebody else are actually quite good for people, because both the exercise and the synchrony with which you do these things, so you're both doing exactly the same moves, creates a sense of relaxation and contentment, happiness with life, all's well with the world, and are very important. So that's my recommendation. It'll keep you going.
Professor Robin Dunbar, many thanks indeed for joining us here on The Agenda. Still to come here on The Agenda, we speak to the psychologist who can explain why your lockdown dreams have been so strange.
If dreams are simulations that are meant to prepare us for important situations we might face later on, then the dreams need to reflect priorities that are important to us.
Welcome to CGTN.
Welcome back to The Agenda. Since the coronavirus lockdown began, many of us have been having very vivid dreams. Google searches for weird dreams have doubled since this time last year. And to explain this phenomenon and what it means for our mental well-being is Dylan Selterman, a senior psychology lecturer at the University of Maryland. So, Dylan, how do our dreams tie into our mental health?
Good question. There are more than a few studies showing that dreams can predict mental health outcomes in several ways. When people dream about emotionally difficult situations they're in, for some people, this can lead to better mental health outcomes in the long run. This is well demonstrated with research by Rosalind Cartwright, who studied people going through divorce and depression. When they dreamt about their ex-partners, having those dreams predicted better mental health for those people.
So when do we dream more when we have a problem in our everyday life?
Sometimes yes, and sometimes it can be because of changes in our sleep patterns, but sometimes our minds are just trying to help us cope with situations, and so we might remember our dreams more. Whether the total number of dreams increases is actually not clear.
Okay, so we may or may not be having more dreams, but we're certainly, if all the research we've done is true, seem to be having stranger dreams during lockdown.
Well, it could be because our minds are just more active in these periods where we're trying to deal with more new situations. When we are asleep, this is a chance for our minds to safely simulate all kinds of experiences, including events that we've been through before and ones we might potentially face when we wake up. So we mostly dream about people, especially people that we know and we're close with. And so dreams might be simulations that can help us prepare for circumstances, but mostly they reflect our approach to social relationships with other people. So to your question about dreams during lockdown and having, more vivid dreams and remembering them more, it's probably because we can't interact with people the way we used to, and so we have to adjust to that.
Well, an extension of that is that some people are having weird dreams because social distancing rules mean that people are worried, and they're more worried about other people, and they see other people as a threat to them.
Absolutely. Yeah, we have to adjust. It's a new world now. So our dreams are trying to help us navigate this new world. A lot of people are having dreams about the challenges of social distancing and avoiding germs. I have personally had those dreams myself. So it's not surprising at all to hear that so many other people are having them too.
Now, we know that dreams are, this is the description, the official description, a reflection of what we've done in the day. But your research is different, isn't it? Your research suggests they aren't just reflective, they can also determine our actions. Is that right?
In a way, yes. My research has shown that when people have a bad dream about their significant other, a romantic partner, for example, a dream that might contain some infidelity or jealousy or betrayal, then when they wake up, there's more conflict with the significant other during the day. And this is independent of the previous day. So there's something about the dream that plays a unique role in that experience.
Some people have also not just been dreaming, they've been having nightmares. What causes the nightmares? I mean, the strong feelings of fear, terror, distress, anxiety. When does a dream turn into a nightmare?
Sure. There's a fine line between, I guess, regular dreams and nightmares, mostly because the average dream contains more negative emotion than positive emotion anyway. So lots of dreams that would normally not be classified as nightmares could be considered nightmares by that perspective. That being said, nightmares can reflect things we're anxious about. They can also reflect mental illness. Dreams don't necessarily turn into nightmares, but they likely start out as nightmares. And this can also perhaps be a way of helping us to cope with things that we are trying to deal with and prepare for. If your mind is going through some negative things while you're asleep, it's a safe way to practice and rehearse for dealing with that thing when you're awake.
So that leads me to my last extremely non-scientific question. In terms of, are dreams a way of clearing the brain of rubbish?
Perhaps. If dreams are simulations that are meant to prepare us for important situations we might face later on, then the dreams need to reflect priorities that are important to us. So our minds might be going through a filtering process like pay attention to this and forget about that. It's important to remember that most of the information we get during the average day, like the people you pass by on the street, is completely forgotten. I mean, you probably don't remember exactly what you ate for lunch on a Tuesday 8 months ago. But if you remember some details about that time, it could be that dreams played a role in that.
Dylan Selterman from the University of Maryland, sleep well, and many thanks for joining us on The Agenda.
Thanks, you as well.
The lockdowns around the world have led to millions of people being shut in at home, unable to go about their normal lives, and quite frankly, becoming increasingly bored. But might that actually be a good thing? Well, joining me now is Dr. Sandy Mann, Senior Psychology Lecturer at the University of Central Lancashire and author of the books The Upside of Downtime and The Science of Boredom, amongst many others. Sandy, why do you think that boredom is such a creative force?
Well, I know boredom is a creative force because I've done the research. And in fact, I've actually done a mini version of lockdown near my university in Preston in the UK, where we've got people actually into a series of isolation cubicles. And we've done the research. We've got people really bored. We've looked to see what happens when people are really bored. And we find that it actually makes them more creative. So we know this happens. And the key to that creativity when you're bored is to let your mind wander, to daydream, to mind wander, and that's a real key to creativity. So this period of lockdown that we're all experiencing all over the world could turn out to be our greatest period of creativity in the whole history of mankind.
That's a very big statement, Sandy. I mean, what sort of creativity?
Well, the research that I've done has shown that we're much better at problem solving, we're much better at coming up with creative solutions to problems if we've had a period of boredom first. So it's all sorts of creativity, and we're seeing it now. It's absolutely amazing to see the creativity bursting forth from people when you look at what people are doing with their kids during lockdown, homeschooling, business ideas. I mean, I'm actually a therapist as well as a university lecturer. And all the things I'm doing now, they said couldn't be done. A month ago, we couldn't do them. I couldn't deliver therapy online. It couldn't be done. I couldn't attend training online. We couldn't teach online. Now it's all being done. We're doing things that they said couldn't be done. And that's because we're coming up with creative solutions to problems that we didn't have before, but we can see the world differently. And I don't know if we'll ever go back to how we were before in all its entirety. I certainly hope not.
But does that only apply, Sandy, to certain types of people? What about people who suffer from anxiety or depression?
Some people are much more adversely affected than others, depending on things like resilience and, like you say, mood and anxiety and depression. But what I'm advocating is that we can use this. So even people who are suffering from low mood, anxiety, and of course there's an awful lot of anxiety, and I'm not trying to dismiss that or belittle that. And there's a lot of terrible things going on. But what I'm trying to say is that there are some positives in every situation. And I think it's a human need and it's human nature to try and get the positives where you can from even the most dire of situations. So even people who are suffering from anxiety or depression can utilise this experience and try and glean the positives from it. It's a bit like sort of what we call cognitive reframing. It's seeing things differently. It's trying to get the positives, as I say, out of a very difficult situation.
What sort of advice would you give to people then so they can kickstart or get their creative juices running?
So this is really important, and this is a real key, because it's not just about being bored and going on the internet and trying to swipe and scroll your boredom away. What we really need people to do to maximise this is to let your minds wander, to daydreaming. This is the real key. This is what my research has shown is the real key to getting that creativity, getting your creative juices flowing. So wherever you are in the world, we're all in lockdown. Some people have more freedom than others, but we can all look out the window. We can all stare at the ceiling. If we're lucky, we can watch the clouds. If we're lucky, we can watch the trees. But we can let our minds wander, and that's the real key. So don't go on the computer. Don't try and swipe and scroll the boredom away. Just let your mind free. Be mindful. Just watch the world go by, or even just stare at the ceiling, and let your mind find its own entertainment and its own creativity. Your mind will do the job. You don't need to do anything else. That's what your mind is programmed to do after millions of years of evolution. It's programmed to find its own stimulation, and it will.
Sandy Mann, author of The Upside of Downtime. Many thanks for joining us on The Agenda.
Thank you very much.
People have been reacting to their lockdowns in very different ways. Some have been enjoying their time home alone. Others have been eager to see their families face to face. But for yet more, especially those suffering from anxiety or depression, it's been a truly horrible experience. Many are struggling with limited finances, job security, juggling home, schooling and work, or missing their schools and friends. The time of the virus is a time of uncertainty, which may well exacerbate existing mental health conditions or indeed trigger new ones. We simply can't return to what some are calling the new normal. We need a new vision for the psychological, social and financial consequences. We must see the hope of a new way of living together. Now, in the UK, we recently had Mental Health Awareness Week. The theme was kindness. This matters more than ever. We know the public acts that have been lauded and applauded, but there has been so much more. Simple, unexpected acts, people reaching beyond the bounds of self-isolation to touch the lives of others. That must become the new normal. Coming up on a future agenda, I'll be speaking to the World Health Organization's Director for Africa to find out why the continent's COVID infection rate is so low. Don't forget, for more agenda content, you can visit our website or you can follow us on Twitter and Facebook. But for now, from me, Stephen Cole, and all the Agenda team here in London, it's goodbye.